Oh, this is such a rich question because pulmonary fibrosis is a group of over 200 different diseases. And one of the problems we have is that the diseases are very heterogeneous, by which I mean they can appear very different in different individuals. And it really is an area where precision or personalised medicine comes into its own because every patient behaves differently. Every patient with idiopathic pulmonary fibrosis behaves differently. So it is a very heterogeneous disease. Can it be cured? In some cases, when we know that the pulmonary fibrosis is caused by another underlying disease, such as rheumatoid arthritis or drug-induced, for example, if you've been taking amiodarone for your heart and you develop pulmonary fibrosis, then by treating the underlying disease, by treating the rheumatoid arthritis, or by stopping the toxic drug, by stopping the amiodarone, we may be able to reverse and maybe even cure the pulmonary fibrosis, and you may not have another problem from it. However, in the more severe cases, so for example, in idiopathic pulmonary fibrosis and in other of the progressive pulmonary fibroses, we may not be able to reverse the disease. We may only slow it down. And in these cases, we cannot cure pulmonary fibrosis. It's one of the great sadnesses of this disease is that we do not have a cure for most cases of pulmonary fibrosis. Now, in a very, very select few of younger patients who are otherwise very well, we can offer lung transplantation, which is the closest we get to a cure. However, as I've mentioned on other videos, which you may have heard, lung transplantation, I always warn patients, it's not a quick fix. It's not like changing your batteries. You don't suddenly have a new set of lungs and you feel fantastic. What you're doing is you're switching one chronic lung disease for another. What we know is that most patients who have lung transplants do feel better, can do more, have a greatly improved quality of life, but they will still remain under hospital care for the rest of their lives, and they will still have to take drugs, many of which have toxic side effects. So I would say, honestly, no, we can't cure pulmonary fibrosis. As for life expectancy, as I've said, and as you can imagine, with such a heterogeneous group of diseases, it's very hard to know how each specific patient will progress or not. So we can see very different outcomes for two patients that appear very similar at the beginning. One might go for 10 years with no progression, and the other might die within 1 or 2 years. So it's very, very hard to predict. What we do know is that in most of the progressive pulmonary fibrosis patients, so these are the ones with the most severe pulmonary fibrosis, average life expectancy without treatment is 3 or 4 years, but there is an enormous spread. But on average, 3 or 4 years without treatment, and with treatment, that probably extends to 6 to 7 years. But again, I really have to emphasize that is when you look at the whole population on average, and there'll be some patients that get worse and die much more quickly than that, and there are others that seem to go on for a much, much longer time. In most cases, we get an idea of outcomes from how patients have previously behaved. So if you've been stable for 10 years, it's highly likely that you'll be stable for another 10. However, patients do continually surprise us. Equally, if you've been getting worse very quickly over the last year, the chances are you'll continue that trajectory, but not always. So we have to watch every patient closely and advise each patient as a unique individual. So again, another really good question, because pulmonary fibrosis does cause lung damage and makes the lungs stiffer. And one of the problems that ensues is that as the lungs have less oxygen, the blood vessels in the lungs actually constrict and become much smaller. And this means that as the heart pumps blood through the lungs, it's having to work much harder to get the same volume of blood through these much smaller blood vessels. So the right heart will eventually be under so much pressure that it will start to fail. And at that point, patients will notice a dramatic increase in their shortness of breath, and they may develop swelling of the ankles and particularly more shortness of breath when they are exercising. So this is called pulmonary hypertension. And the way we treat pulmonary hypertension is to use diuretics to get rid of some of the fluid so the heart isn't having to work quite so hard. We also make sure that the patient is really properly oxygenated, particularly at night when they're asleep, because this again takes some of the pressure off the heart by opening up the blood vessels. That's really probably the biggest complication of pulmonary fibrosis. We also know that patients with idiopathic pulmonary fibrosis are at increased risk of lung cancer. So we're always very careful to screen these patients appropriately to make sure that if we do pick up an early lung cancer, we do it as early as possible so that the treatment is the least invasive that it has to be. The other problem with pulmonary fibrosis is it can cause weight loss, and it can cause a weakening of the muscles just because they're not used as much. So the medical term for this is sarcopenia. And what we know is that if you are a patient with pulmonary fibrosis and you develop muscle weakness because you can't exercise as well and you're not eating as well, then this does reduce your life expectancy quite dramatically. Well, this is a question very close to my heart because we do a lot of clinical trials, because it has to be said, although we have treatments at the moment for all the different types of pulmonary fibrosis, I would say that the treatments have limitations. They may not cure the disease, they just slow it down, and they often come with side effects that many patients find very, very difficult. So I would say throughout the country, most hospitals will be able to refer you to take part in a clinical trial if you want to with pulmonary fibrosis. And usually these trials allow patients to take part who are already on treatment, so you don't have to stop your regular treatment for pulmonary fibrosis to take part. It's an add-on treatment. Many patients enjoy taking part in clinical trials because you get seen more frequently. Often the hospital will arrange transport, which is funded by the company that's trying to develop the drug. So you'll be taken and ferried to and from the hospital for more frequent treatments. And even if you draw the dummy drug, which I'll explain in a moment, it's still showing that patients in clinical trials actually do better than patients that don't take part in clinical trials. So when you do take part in a clinical trial, you're often offered either the real drug or the dummy drug, which is a placebo, which looks exactly like the real drug, is taken in the same way, but neither you nor your physician know whether you have the real drug or the dummy drug. And the idea of that is so that we can really see if the drug makes a difference or whether it's just a so-called placebo effect. In most cases, your chances of getting the dummy drug are less than 50%. So, for example, for every 2 or 3 patients given the proper drug, 1 will be given the dummy drug. But as I say, even if you're given the dummy drug and you take part in a clinical trial, you do seem to do better, probably because you're watched over so closely by the medical team. So this is a very important question because the National Health Service can do so much, can treat you with medications or oxygen, but actually we've already discussed the time between appointments may be quite drawn out, so you may not see your physician for 3 months. And what can you do in the meantime to draw some help from either online or community resources? So I would say they're very good online resources. Action for Pulmonary Fibrosis is a UK-based charity that supports patients with pulmonary fibrosis, and Breathing Matters, of course, has patient resources. There are also patient groups. We have one at our hospital that meets every 2 to 4 weeks, and they discuss different aspects of pulmonary fibrosis. And there are also online communities. And I think Action for Pulmonary Fibrosis is a great supporter of patient groups, both online and in person. They certainly support our patient group here at UCLH. There are also other resources. In person, we can sometimes arrange community physiotherapists, but I think really importantly is your community gym, which may have classes for patients with lung disease. Once you've checked with your physician that it's all right for you to take part, then I can really recommend joining a class or a group for older people or even older patients. Many of our patients get introduced to exercise through pulmonary rehabilitation, which is organised in the community. And then from these classes, they're then advised how to go about continuing the exercise regimes, either at the gym or at home. We're hoping to produce some online videos to help with breathing. I can link some of them below. So this is just to help you use your diaphragm more when you breathe, which is really important. And also some links to other groups and exercise classes that can be done in the comfort of your own home.